Hi, welcome to Health Matters, the health information show that matters most to you and your health. I'm Rosie Smith, the hostess for today's show, and I am delighted to bring you to our groundbreaking event right here at Jackson Hospital in Marianna, Florida. Today is August the 16th, and today was our day of the first diagnostic heart cath at Jackson Hospital. Joining me is Dr. William Dixon. He's our board-certified cardiologist with Southern Medical Group, and he is affiliated with TMH as they provide training and support for Jackson Hospital as we bring this new service line to the area. So Dr. Dixon, tell us what you did today.
So today we did the first diagnostic cardiac catheterization, so looking for blocked arteries. And you can see an image behind us from this morning that was done in this room right where we stand. Brand new room, state of the art. Most hospitals in the country don't have a cath lab this nice, I'll just tell you. We have similar equipment in Tallahassee, but this is all state of the art. And this was visionary based on the part of Jackson Hospital administration to think ahead in the future.
And this is 9,000 square feet of new OR footprint for the hospital. And the former footprint of the OR is now going to be retrofitted for new patient admitting, pre-admitting, post-anesthesia care unit, and other type space as we expand our surgical presence. So what are some of the other cardiac procedures that we can now offer here in this room?
So in this room we do diagnostic cardiac catheterizations. We also do diagnostic peripheral studies. So we look for blocked arteries in the heart. We also look for blocked arteries in the legs.
Okay.
Identify that and then come up with the best treatment recommendations. In a different room in the OR, we offer what's called transesophageal echocardiography, which is an advanced form of ultrasound to look at heart valve problems primarily. We do procedures to try and treat abnormal heart rhythms. Before the past year, I've had to send patients to Tallahassee or they've had to go elsewhere for these procedures, but now we can keep them here in town. They don't have to drive and can do the same quality treatment here that we're doing in Tallahassee.
What made you want to be a cardiologist, Dr. Dixon?
To me, cardiology was easy to understand. I didn't have to memorize a lot of things. There's a lot of plumbing involved, so valves and pumps and pipes, which made sense to me. I didn't have to memorize a bunch of esoteric information. I enjoy doing the procedures, and you can make a big difference for patients. They can feel better very quickly.
Well, that is very inspiring, and Dr. Dixon did his training at the Brooke Army Medical Center in Texas, and he did his internship, his residency, and his cardiology fellowship, and then an interventional cardiology fellowship at Duke University. So he is extremely well trained and skilled, and we appreciate certainly your service to our country. I know you did some tours of duty with that, and got some medals, so we are very proud of that. We are very excited as Jackson Hospital expands its services, and as we were talking before we began rolling the tape, that to provide this kind of service in a rural area where the closest you have to drive is about 50 miles is just groundbreaking for us and our community. So we're like the next closest cath lab is about 60 miles. So we are really excited to have you here and do this. Is there anything else you want to kind of show us on the screen or talk about with new cardiology services here?
Well, my goal, I've been coming to Marianna for 4.5 years now, and my goal is to keep anything local that I can. So, I mean, we come here for the patients. So if I can get procedures done here, then the families don't have to travel, the patients don't have to travel, they don't have to stay overnight for things, and it's just better for the community. So Jackson Hospital has been absolutely supportive. Basically anything I've asked for, and again, this is a state-of-the-art cath lab that any hospital in the country would be envious of.
Do you think one day we'll have enough training and sophistication we'll be able to do interventional cardiology?
It's certainly a possibility. I know my group at Southern Medical Group would support that. You want to do things the right way, make sure things are safely done, but as technology advances, I certainly don't think it's out of the question to not only find blocked arteries here, but also open them.
And what is one message to our patients about how they maybe can take better care of themselves so that way their outcomes are even better? Just lay off the sweet tea and the fried chicken and all that kind of diet plays a big role in blocking arteries?
Diet plays a big role, but if somebody smokes, if they're willing to quit smoking, I'll let them eat whatever they want to.
That's a good trade-off.
Smoking is by far the worst risk factor for heart disease peripheral arterial disease and stroke.
All right, viewers, so if you're smoking, stop smoking today, and then you can drink all the sweet tea and fried chicken you want within moderation.
I'll make that deal. Yeah.
All right, well, how do folks get a hold of you? If they, obviously, do you take referrals from a primary care physician, or do people just call you up and say, I need your services?
Well, people are learning about us, but primarily the referring physicians here in town. There's an outstanding group of primary care physicians, and it's not like that everywhere. So the docs here haven't had cardiology consistently, so they've had to do a lot of it themselves, and they're very good at it. But I'm happy to help anytime they feel somebody needs additional care or additional expertise. So all the primary care docs in the area know how to get people to us, and we can also provide contact information, and we're happy to see patients. That's why we're here.
Well, excellent. And you're here in Marianna on Wednesdays.
For now, we're here on Wednesdays. That's very possibly going to expand depending on how busy we get. We're seeing more and more patients every time, so maybe more than just one day a week in the near future.
Well, that would be terrific. And we, again, really appreciate bringing these services to our area and using our brand new OR. All right, viewers, if you want to get a hold of Dr. Dixon, his office is 850-482-2205. Again, that's 850-482-2205, and you can learn more about cardiology services that Dr. Dixon provides and his group Southern Medical, affiliated with TMH, provide right here in Jackson County at Jackson Hospital in Marianna. We're all out of time now. Enjoy the panoramic view of the new hybrid room at Jackson Hospital's OR suite. Thank you.
You're watching Chipola College Television.